Hi, it's Wednesday morning. It's about 8:15 or so, and I'm here to speak at the ACIT out in Huntington. It's a great organization based in small business, commerce, industry, technology here on Long Island. And basically I'm here to give my wrap-up of the world, but especially as it affects the economy here on Long Island. And of course the issue of the day being healthcare, but also talking about international terrorism, talking about the stimulus bill, and basically talking about where we should be going as a nation and how we evaluate President Obama over the first 6 months or so. So with that, I'm off inside to give my speech. History to decide that, but the fact is we are where we are now. Now, I think that the President, I voted against the stimulus bill. I was actually prepared to vote for a stimulus bill. In fact, the original bill that the President proposed before inauguration, when they floated out a bill which would have had significant tax cuts, significant assistance to small business, and solid infrastructure spending, I think there would have been a bipartisan consensus for it. Listen, there was always going to be some opposition. In fact, there probably would have been some strong Republican opposition, but I think you would have seen a significant number of Republicans going over and working with the President on it. Instead, I believe the mistake he made was in turning it over to the Democratic leadership in the House, and so much went into that bill, which really did not directly affect what I think were what was needed, the stimulus that was needed. And then again, I would talk about small business tax cuts, I would talk about needed infrastructure spending, which just wasn't there. And so I think it was an extraordinary amount of money that was spent, and I don't think it's going to have a short-term impact. Now, in fact, most of the money will be spent in several years from now. As far as the energy bill that went through several months ago, again, on that, I think, and not to oversimplify a very complex bill, the bottom line is it will have standards applied to American business that will not be applied to China and India. I can see many businesses moving from the United States over to China and to India, which to me will have a very serious impact on the American economy. Also, I've been told, though, from a number of people in the Senate in both parties, that that bill will not pass the Senate anywhere near its current form. Now we come to health care. Let me just say something in fairness to President Obama. He's really not doing anything that he didn't say he was going to do. I think in the course of the campaign, people were so focused on change, they wanted things to be different. They were tired of President Bush, they were tired of Republicans. You know, it's hard for me to believe anybody would be tired of me, but I'm sure quite a few people were. And it was just they wanted something different. And they saw President Obama as a 21st century man personifying youth. If the President had done the health care plan back in February, it probably would have passed. But after the stimulus bill, after the cap and trade bill, and after more supplemental bills, and now to have this health care reform issue coming up, I think American people are saying, stop, let's slow down. And they're starting to realize that the President, either he was interpreting a mandate he didn't really have, or he realized that his numbers would only stay so high for so long, and he wanted to get as much done as he could while his numbers were still high. But there's so many bills out there. There's Henry Waxman's bill, there's Charlie Rangel's bill, there's several bills going through the Senate. And to say all of this had to be done by August 1st or August 2nd, I think that's when people started to realize this has gone too far. This is just too much, and that's why you're seeing this pushback that we see now. When we go back in, which will be right after Labor Day, I think it's going to be very difficult to get anywhere near, for the President to get anywhere near the type of health care reform he wants. Now, the position he's in, and the tough spot he's in, is that certainly the liberal base of his party is insisting on having a public option, a government option plan. He has 40, 50, 60 blue dogs in his own party who say they cannot accept that. If he goes one way or the other, it's going to be impossible for him to get a majority of votes. So that, in many ways, this is for the present time, is a dispute within the Democratic Party. Having said that, all of us are participants, all of us have to be involved, and I think what you'll be seeing is that when an opportunity does come to forge compromises, you will find people, certainly among Republicans and more conservative Democrats, trying to find a way to forge a compromise. But it's going to be difficult for the President, and he's in a very, very tough position. Is Ed Koch, who was a big Obama supporter, and the main reason he supported Barack Obama was because he wanted universal health care. Well, yesterday Ed Koch had a 5-page op-ed where he is now broken with President Obama and no longer supports his health care plan because Ed Koch just went through 2 massive surgeries. And as he reads the bill, he does not think he would be allowed to get those surgeries in the future. Now, I know the president says you can keep your private coverage, but Koch actually goes step by step as to whether or not he'd be allowed to retain his private coverage. And would a person who's 84, 85 years old be authorized to have surgery which costs over $1 million? Ed Koch's surgeries of the last 2 weeks at a cost of $1 million. And he believes that as the system goes forward, someone similar to him 5 or 10 years from now will not be allowed to have that surgery. Now, whether or not he would, these are legitimate issues raised by Ed Koch. Now, of course, a small business. They're talking about the 8% tax on companies who hire X number of employees. We're talking about nothing being done about malpractice reform. We're talking about, of course, the Congressional Budget Office said, what, $1.3 trillion over 10 years. Generally, those estimates end up being lowballs, as we know. Now, nothing has been done to try to inject the private sector anymore. For instance, allowing small businesses to form consortia where they could form groups to negotiate with employees instead of more group plans to get the benefits of that. Of actually defining who needs health care and who doesn't. Should everyone have the same policy from 18 to 85 or to 90? So the way you approach it, I believe, the best way to be would be, because I don't think you can look at it as one large system. Factor or target areas that we can agree on need improvement and have intensive debate over that and see what the costs are. I mean, I say shifting tax rates, going after one industry rather than another. And that, I think, is the chaos that's being created here. And I know what the president says about being able to maintain your own policy. I don't believe you will. And I think that once you do get the public option in there, depending on how it's implemented, and generally government always puts more into it, it's going to be hard for private carriers to compete with that. It's also going to be difficult for small businesses to maintain their coverage. I think they'll just opt, maybe even take the 8% fine. Now, whether they can afford that or not, I don't know. And that's another impact we have to. So I don't see how this gets wrapped up in a short period of time. I mean, if we just wanted to sit down, all the people in this room, and just say, what is the impact going to be on small business? That could take, just think how long that would take. But you start thinking the impact on the pharmaceutical industry, the impact on hospitals, the impact on teaching hospitals, the impact on rural hospitals, the impact on inner city hospitals. We can go through it step by step. The impact on senior citizens, the impact on young people who may not need that type of extensive coverage at their age, who would be willing to just take a policy which has a high deductible and covers against catastrophic. I mean, we can go through all of this, and yet the president wanted to resolve that in 3 weeks. And now, I think they want it done by October 1st or October 15th. It's just not good. Crowd, good speech, good response. People were very supportive, very friendly. Those who disagreed. I would say in a good way, and most, though, I'd say agreed. So anyway, back to the office, and then I'll be talking to you soon. Thanks.